Hello, thank you for visiting this training video hosted by Gainwell Technologies. Today I'm going to show you how to enroll a new individual within a group in the Provider Management module for Vermont Medicaid. Before we begin, please note that this video is intended for informational purposes only and does not guarantee approval of your enrollment in Vermont Medicaid. If you have questions regarding Vermont Medicaid's enrollment criteria, please contact the Provider Services Help Desk at 802-878-7871, or you can email us at vtproviderenrollment@dxc.com. For today's training, I'm going to start on the homepage of the Provider Management module. You can access the link to the Provider Management module by visiting www.vtmedicaid.com and click on the Enrollment tab. To begin a new enrollment, I'm first going to click on the menu button that's located on the top left hand of the screen. Under that, I'm going to hover over Provider Enrollment, and then I'm going to select New Enrollment. This is going to bring me to our welcome page, and this welcome page is designed to give you some more information on the information that you may need in order to complete your application. There is an enrollment pre-checklist. This is not required. This is just another tool if you wanted to get more specific about your enrollment type, your provider type and specialty, in order to really be prepared on what questions or what documentation you may need in order to complete your application. When you're ready, you can click Start to continue. The first thing that we're going to need to do is we're going to need to register this application. Every new application that you start must be registered, and that's in order to obtain an ATN or an application tracking number. That number is going to be unique to this specific application. So you're going to want to provide an email address as well as a password, and this email address and password combination will allow you to get notifications about the application and be able to resume and check status of your application once submitted. You can also enter a provider reference. It's not required. This is just a reference for you if you're doing multiple applications and you want to easily be able to identify throughout the application which one you are working on. You can certainly do that. Once you're ready, you can click Register to continue. This has now launched us into a brand new application. The first thing that's going to pop up is that ATN or that application tracking number. It's also going to send an email to the email that you use to register the application with that tracking number. So you don't necessarily need to make sure that you write it down. It's going to follow you throughout the application, and it will be in that auto-generated email to you. So we're going to click OK. Now, before we begin the application, I want to note a couple of things within this module that may help you as you go through. First, as I noted, is going to be your application tracking number. That's going to be at the top of every page as you go through the application. And below that is going to be that provider reference if you chose to enter something. If you didn't enter anything, there's just going to be nothing here. But this is, again, an easy way for you to identify which provider that you are currently working on as you go through the application. There is page level help. So for each page that you go through this application, you can look at page level help if you're unsure of how to complete it. And that's going to be indicated by this blue question mark that's at the top. You can click it to get more information about the page that you're currently working on. There's also field level help. Above each field, there is a gray question mark, and if you hover over that question mark, it's going to give you more information about that specific field that you're working on and what needs to be entered, or a special note about that field specifically. Anything with a blue asterisk is required, and you won't be able to go on to the next page until you have completed everything that has that blue asterisk. So the first thing that I'm going to do is I'm going to select our enrollment type, and I'm going to do that by clicking the drop down here. And as indicated at the beginning of the presentation, we are doing an individual within a group today. And you will notice that once I selected my enrollment type, a blue box has come up to let me know that once I fill out everything on this first general information page and I save it, I won't be able to go back and change my enrollment type. There's a couple of reasons for this. You'll notice that once I selected the enrollment type 2, all of these panels behind here have been generated. The enrollment type and the provider type, once selected, drive the entire application. So that's why you're not able to go back and change it once you have saved it, because the application moving forward is tailored to these two specific pieces of information, so we can't change it. If later on in the application you realize that you selected the wrong enrollment type or provider type, you would need to stop the application, you can abandon the application, and you would have to start over. So I'm going to click OK to continue, and then I'm going to select my provider type, and again I'm going to choose the drop down, and today we're going to be a physician. And you're going to get the same warning box that says, just like the enrollment type, your provider type you also can't change once you have saved this first page. So I'm going to click OK to continue. I need to choose an effective date, and you can choose a date that is up to 1 year in the past or up to 90 days in the future. The next thing I need to do is fill out information regarding this individual provider. So last name and first name are required. You are not required to enter a gender or ethnicity, but you can if you so choose to. You must enter in a birth date and a social security number for this individual. You're also going to be required to enter in the NPI of the individual, and the module does recognize what is a valid NPI. So the NPI must be 10 digits long, and it will note that you can't enter a bunch of 9s or 10 8s. It does have to be a valid NPI, and it's not going to let you continue on this first page unless it recognizes that it is valid. We're going to ask you 3 questions after that. The first one is, are you currently enrolled as a provider? If you choose yes here, you're going to get a red warning box that's going to appear and is going to ask you if you are actually trying to revalidate versus enroll new. And that's because if you're saying you're already enrolled as a provider, this wouldn't be the avenue to revalidate. If you needed to revalidate every 5 years, this is not going to be your avenue to do so. So if you are here to revalidate and you choose yes, it's going to abandon this application and it's going to bring you back into the home page in order to revalidate. But if you choose no, it's going to drive you right back to this application itself. And if you do continue to choose yes, you will need to enter in your current provider number in order to continue. We're going to choose no because we're a new provider. And then it's going to ask if you were previously enrolled as a provider. Maybe you were in the Vermont Medicaid network before and you're just coming back to re-enroll. And if that is the case, again, a box is going to populate to the right, and you're going to need to let us know what your previous provider identifier was. And lastly, we're going to ask you if you are Medicare enrolled. If I choose yes here, there's nothing that populates, but later on in the application, we will be required to enter in that Medicare information because we chose yes here. So I'm going to go ahead and just leave it as yes so you can see how that works later on in the application. The next thing that I have to do here on this first page is enter in contact information, and this contact information is for this application specifically. Who do we contact? Who do we send notifications to regarding this application? And you're going to notice throughout this entire application, there's several different places that we ask for contact information, and they all mean different things. So you would just want to make sure that this first page, the contact information, is who gets the information regarding this application if we have questions. So I'm going to enter in a name, and I'm going to enter in an address. And you'll notice that when I tabbed through the zip code, it's going to start processing. And that's because every address that is entered into the provider management module must go through the USPS software to validate that address. So it came back with a recommendation for a change. It's noted here on this line item, and it just looks like it added the last 4 digits of the zip code there to make it complete. So I'm going to go ahead and accept the changes by simply clicking on the line item. If for some reason you do not want to accept the changes that they are recommending, you can bypass that by Xing out of this field or this box, and it will just keep the information that you have, but we will have to validate that address during screening of your application. So if it's coming up as a recommendation and it's something like what you just see here where it's just adding the last 4 to the zip code, we do recommend that you go ahead and you just accept the changes there. So I'm going to go ahead and accept them. I'm going to click on that. I need to put in a phone type, so I'm going to choose work number. If you have an extension or a fax number, you can enter that here, but it's not required. And then you're going to notice here that email address is not a required field. However, right below the email address is your preferred communication method. You need to tell us how you prefer that we communicate with you. And you have 2 options, either email or mail. We're going to highly recommend that you choose email for your communication. The reason for this is you're going to get notifications much quicker if we are able to send them to you via email. And there are time restrictions on some of the notifications when it comes to your application. For example, if we need to return your application for any reason because we need more information, there's a 14-day timer on that return before your application is locked out and you would have to start over. So if you're getting that by mail, the notification needs to be printed and it needs to be mailed and you need to receive it and be able to process it. Whereas if we send you an email, it's going to go right out and you're going to get it right away. So I'm going to choose email for today. And then you'll notice that all of a sudden I have an asterisk here on the email because I chose that. So I do need to make sure that I enter an email. So I'm going to enter it and I'm going to confirm it. And then I'm ready to save and continue this first page. However, I do just want to stress and go back up to the top that as a reminder, before you hit save and continue, make sure that your enrollment type and your provider type are what you want them to be. Because again, once I hit save and continue, I can't change it. I can come back to this first page and I can update the other information that I have here, but I cannot update these 2 pieces of information. So be really careful and clear that they are what you intend them to be before you move on. So I validated it. This is exactly what I want it to be. So I'm going to go back down and I'm going to hit save and continue here on this first page. So the second page of the application here is the specialties page. And before we enter in the specialty information, I do want to make note of how the progress of your application is going to go. You will see that the page that we're currently on is indicated in yellow here, and any previous pages that you have completed are going to be white, and you'll be able to see that I can go back to that page. You'll also notice that I can't move forward and jump around pages. So I can't jump to one of these pages. They do have to go in order. So those will all be blue until I have either gotten to that page, which will change it to yellow, or I've already completed it, which will turn it to white, and I'll be able to go back and review it if need be. But I did just want to note that you do have to go in order of the pages. You can't skip around to a page later on. So we do have to enter a specialty related to our provider type, and you're going to see that our provider type is listed here from our first page. And in order to do that, the first thing I'm going to do is hit Create New here on the right-hand side within this box. That's going to open up another window in order for me to enter in my first specialty. Now I have to make at least one of my specialties primary, so I'm going to click that this is my primary specialty. And then I have an option to choose from a drop-down list. This list is generated based upon the provider type that we chose. So because we chose physician, we are only going to see specialties that are allowed with that provider type of physician. So this is where it's really important in the beginning to choose your provider type. So if you're looking through this list and you don't see your specialty, review your provider type. Did you choose the right one? And if not, that's where you're going to have to start over again. But you're, again, only going to see specialties that are allowed with the provider type that you have chosen. So I'm going to choose general practice for today. And then I need to select a taxonomy. And again, just like the specialty, I'm only going to be allowed to choose a taxonomy that is available for the specialty that I chose. I won't be able to choose from all the taxonomies that are available out there. It's very specific to the specialty that I chose. So I'm going to choose general practice, and then I need to choose an effective date. And I just want to make sure that I'm noting to be very careful on the effective date of your specialty. If you have asked for an enrollment date that is in the past, maybe it's 6 months in the past, you want to be enrolled backdated to that day, your specialty needs to be backdated that far as well. And that's in order for your claims to process correctly. If you ask for a backdate and then you try to submit a claim for a date of service within that retro period, but you've chosen to make your specialty effective as of today, you won't have an active specialty for that claim that you're trying to submit. So just make sure that your specialty date aligns with your backdate request if you so choose to do that. Once you've added the information, you can hit save. And now you have a line item here to satisfy this specialty requirement. If you have multiple specialties related to your provider type, you can just repeat that process and add another specialty. The only difference is you will not make it primary because you can only have one primary specialty. If you have multiple taxonomies associated to a single specialty, then you can report those additional taxonomies here in the additional taxonomies field. You can't duplicate a specialty up in the top box, so I couldn't put another general practice and add a different taxonomy here. If I have multiple taxonomy for this one specialty, I have to report them separately down here. And again, it's the same idea. You hit create new, and it's going to bring up another window, and you'll be able to select from a drop down of allowed specialties or allowed taxonomies for that general practice specialty, and you can add the second taxonomy and hit save. Once you've added all of your specialties, you can hit save to continue. The next page of our application is the service location page, and this is where you're going to give us some more information regarding the restrictions or practices that you have at the service locations that you practice at. So the first thing that we're going to ask you is if you are accepting new patients with special needs, if you have any age restrictions, and if you do, you just select the box and then you can enter in the minimum and maximum age. If you don't have any, you can just leave it blank there. You don't need to select anything. What you do have to select is the drop down for accepting new patients. You need to let us know if you're accepting new patients, if you're accepting existing patients only, or if you're accepting family members. So we'll say we're accepting new patients today. And then if you have a preferred patient gender, you need to let us know that for your practice, whether it's female only, male only, transgender, or you can choose that you have no restrictions. Once you've entered in the information, you can hit save to continue. The next page of the application is the capacity tab. And what we're looking for here is for you to tell us how many Medicaid members you are willing or able to see at your service location. So again, the same concept, it works throughout the entire module. I'm going to hit create new to open up a new window. I'm going to select my state. I'm going to select my county. And then I'm going to give the maximum number of Medicaid members that I will see per specialty. So if you had multiple specialties here, you would see multiple entries. You would see another box right below this one that said capacity by specialty, listing the other specialty, and then we would want you to tell us, okay, how many members will you see for that specialty as well. Once you've entered in all the information, you can hit save to continue. The next page of our application is the associations page. And because we're an individual within a group, we need to enter in which group or groups that we are affiliated with. So this can be a number of different service locations or a number of different groups that you are associating to. There is no maximum amount of entries that you can enter here. We want you to tell us where you're practicing at, which groups are you practicing at. And I do want to note that in order for you to associate to a group, that group must be actively enrolled in Vermont Medicaid. If they're not actively enrolled in Vermont Medicaid, you're not going to be able to find them and associate to them. If you are enrolling as an individual within a group to a new group, you're going to need to wait for them to enroll before you can enroll and associate yourselves to them. But if they are actively enrolled and you're ready to make that association, we're going to go ahead and hit Create New to open up a new window and make that affiliation. So there's a couple different options that you have on how to look up a group within the module. The first is the provider ID. So each location for a group has their own service location ID, and this is a 14-digit ID. This ID can also be found on our provider lookup at vtmedicaid.com. So if you're not sure which provider ID you are associating to, you can absolutely go out there and find this number. Or you have the option to search by NPI, and it will bring up all of the service locations, and you'll be able to choose from which service location that you want to associate to. So I'm going to show you that here. I'm going to put in the NPI of the group first, and I'm going to hit search. And what it's showing me is that this group has two provider IDs that I can associate to. And that means it has two different service locations here indicated by 0001 and 0002. Now, if you associate to both, you would just want to do one at a time. I'm going to click the first one first, and it's going to populate the information in here for me. I do need to choose an effective date of when did I start with this group. And it's going to automatically populate what we call the end of time, the 12/31/9999. Now, if you have a date that you know you're going to stop with the group, you can absolutely put an end date in here and it will end you when that date comes by. But if you don't, we recommend you just leave it as that 999 year. And then if you ever disassociate to the group, you can let us know and we can take you off. So I'm going to go ahead and hit save. And here is my first association. Now again, if I wanted to make sure I was associating to the other service location, maybe I practice at both places, I can hit Create New again. It's going to bring up a brand new window for me. And this time I'm going to show you, if I have the provider ID already, what that looks like. So I have this provider sitting out here, this provider ID, and I'm just going to choose the second location. So I'm just going to do the 0002 location. And I'm going to hit search. And there it is. It populates all the information for me. Again, I need to enter an effective date, and I'll leave the end date because I don't have a date when I'm going to stop associated to that group. And I'm going to hit save. And now I have two associations. And again, you can do this as many times as you have associations to enter, and they don't all have to be with the same group. So if you travel and you go to different groups to practice, you can put in as many in here that are actively enrolled in Vermont Medicaid that you are affiliated with. Once you have entered the necessary information, you can hit save to continue. We are now on the Credentials tab of this application. And the first thing that we're going to ask you is about degree. This is not a required field. However, if you wanted to provide the information to us, you can absolutely do so. You would do the same thing. You would hit Create New, and you're going to give us the degree, school, and year of graduation. You will be required to provide a license. So I'm going to hit Create New in order to enter in my license information. I'm going to enter in my license number, the state in which I was issued this license, I also need to add the issuing board, and the effective and end date of this license. You can hit save. And now I've satisfied this requirement. If you do hold multiple licenses, you can enter in as many as you have. You would just repeat the process, hit create new, enter the information again. Under that, we're going to ask you if you are enrolled in any other state Medicaid programs. If you choose yes here, another box is going to open, and you are going to be required to give us the information of the other state Medicaid programs that you are enrolled in. You would need to give us the program, the state, and effective and end dates of that enrollment. If you are not and you hit choose no, you can simply move on to the next question. If you have a DEA to enter, you can enter that here, but it is not required. Once you've entered in all the information on this page, you can hit save to continue. On the provider type panel, the only thing that we're going to ask you here is about CLIA. So if you have CLIA information that you want to enter, you can enter that here. It is not required, so if you do not, you can simply hit save and continue. So we have made it to the other tab of our application. And the first thing that we're going to enter is any languages that are spoken within the organizations that we practice at. So I'm going to hit create new to enter the first language. And very simply, you're just going to choose from the drop down. You're going to select a language and hit save. If you have multiple languages, you can just simply repeat the process. You can hit create new again, drop it down again, select another language, and hit save. And you can do this for as many languages that are spoken within the service locations that you're practicing at. If you hold any certifications that you want to report to Vermont Medicaid, you can do that here. Again, it is not required. You would simply hit create new, enter in the specialty that is associated to, the certificate type, certificate number, and effective and end dates. If there is a website that you want to report and have available on the provider directory for members who are looking up different providers, you can enter that here. Just be sure that it begins with HTTP or HTTPS in order for it to be a valid URL. You are required to enter in malpractice information. So you're going to hit create new to start that entry. You first need to select the type of carrier, whether it is general liability or professional liability, the name of the carrier, your policy number, the aggregate, and the per occurrence. Now, you're going to notice a couple different things here. First of all, you'll notice that I didn't enter in any special characters, and that's because the module does not recognize commas or periods or dollar signs. So don't enter any of those special characters. It's going to kick it out and it's not going to be able to save for you. Also, the module is intuitive to recognize that the aggregate should be more than the per occurrence. So if you accidentally flip those two numbers, it's not going to let you continue. I do also need to enter in the effective and end dates of my policy. And again, this effective and end date has to span the enrollment period that you're asking for. So if you're asking to be enrolled 8 months in the past and you've received a new malpractice liability sheet, you need to make sure that you are providing to us the liability coverage that was in effect 8 months ago so that we can show that, we have that coverage here for your enrollment application. So we're going to hit save. And then under that is going to be a question that asks us if you currently have or in the last 10 years been involved in a malpractice suit or claim. If you hit yes, there is a box that is going to open up and you are going to be required to provide the information regarding that suit or claim. You're going to need to give us the patient name, the policy number, what your status is in the case, the plaintiff, and the status of that suit if applicable. If not, you just simply hit no. There is no box to fill out and you can move on. If you need to report a medical related organization, including laboratories, home health agencies, radiology facilities, or something of the similar, you can do so here, but it is not required. Once you've entered in all the information for this page, you can hit save to continue. The next page of our application is the disclosures page. It's very important that you read through the Privacy Act notice statement, as well as ownership controlling interest and any disclosure forms. This is important information about why we're asking you to disclose this information. For an individual within a group, however, the only disclosure form that you are going to be required to fill out is the self-disclosure. Any ownership or managing employee will be reported on your group's enrollment application, so you're not required to enter that information here. So to begin your provider self-disclosure, you're going to first hit Create New here on the right-hand side. This is going to open up a blank provider self-disclosure form. And you'll see here that it has carried over some information from the beginning of our application, my name, my social security number, and my birth date. And then there's going to be a series of questions. And it's very important that you read these questions carefully because depending upon the question, depends on how you're going to answer it. You will notice here on this first one that they're all going to be yes right off the bat. So you're going to want to go through each one. And on this first one, I'll give you an example here. Has any action ever been taken against your license or certification by any state or certification board in the past 10 years? If I leave it as yes, I do need to enter in more information about why I chose yes here. But if my answer is no, that box beneath that is going to go away. I have reviewed these questions, so I'm going to go ahead and just answer them accordingly. And then you're going to notice about halfway down the page here, we're going to ask you for some more contact information. And again, this contact information may be different than the contact information that you gave us earlier on in the application. The contact information in your self-disclosure is the contact person for auditing purposes. So in the event of an audit, who do we need to contact? So just be careful that you are entering in the right contact information that you want here. And again, as soon as I put my address in and I tab through that zip code, it's going to go through the USPS software in order to validate. I'm going to go ahead and accept the changes by clicking on the line item. I do need to provide a phone number. And then the next address I need to provide is the physical location of my records. So as you'll note, it's noted here that this cannot be a PO box, and that is for obvious reasons. Your provider records are not being kept, or your patient records are not being kept at the post office. So you need to make sure that you're providing a physical location. So I'm going to put the address there, tab through that, and let the USPS software work. Go ahead and accept those changes. And then I also need to provide a phone number in case I need medical records. Who do I contact? I'm going to go through the rest of these questions. And once you have answered all of the questions, provided all of the information, and entered in all the contact information, you are then ready to save your provider self-disclosure. Now, once I hit save, you're going to notice that the status down here is now completed. So you are now ready to move on from this page. I do want to note though, before we move on, if you need to go back and review your information in your self-disclosure, maybe you need to make changes or somebody else has to look at it before you submit it, you can access that by clicking anywhere here on this white line item. So if I just click, what it's going to do is it's going to bring up my self-disclosure. Here it is. And I can edit it, and it will bring up the form just as I filled it out with all of my information. And now I'm able to review or make any changes if need be. We're going to simply close that out because we don't want to make any changes at this time. And since I'm completed, I'm going to hit Save to continue. The next page of our application is the attachments page, and this is where you're going to need to provide documentation regarding certain criteria for your enrollment type and your provider type. So you'll notice here at the top, it's listing my provider type and my primary specialty. And it's going to note here that below is the list of required attachments. If you are enrolling in EFT, you're going to also need to provide EFT information in way of a voided check or a bank letter. This is not going to be noted here on this page. For an individual within a group, you didn't have an EFT panel. That's because your group is the one that is getting the payments. So I don't want you to be confused by this, saying you never got the option for EFT. It's because you're an individual within a group, so you don't get presented with the EFT panel. But what we do need to be focused on is the attachment types that are required here. So it is saying that I am required to upload a W-9, a proof of my license, and proof of professional liability insurance. And you're going to notice that the requirements met are all to no. We need all of these to be yes in order to move on with this application. And the way that we do that is we action each one of these below in the attachment details. So the first thing I'm going to do is I'm going to hit Create New down at the bottom. The first thing we're going to need to do is we're going to need to select our transmission method. So if you drop the box down here, you're going to notice that there's a couple different options that you have in order to get this documentation to us. We highly recommend that you choose electronic and upload the documents right to your application. And the reason for this is if you do so, when you submit your application, it's going to automatically start going through the screening process. If you choose to send us your documents by mail, by email, or by fax, when you submit your application, it's going to go into a holding status waiting for those attachments. And you will have a 14-day time frame to get the documents to us and have us upload them for you before your application is locked out. So if we don't get the documents in time and they're not uploaded within those 14 days, the application is expired and then you will have to start the process all over again. So if you have the option to and are able to, again, we recommend that you choose electronic only. So I'm going to choose electronic for today, and my attachment type has to match the attachment types that are over here. So we're going to start with our W-9 form. I'm going to drop the box down, and you're going to notice there's a whole lot of different options here. You can do a predictive search and start typing the document that you are looking for. I typed in IRS, and I'll see my IRS W-9 form right here. So I'm going to select that one. Now, because I chose electronic only, I'm going to go ahead and find the file on my computer that is my W-9 form. So I'm going to hit Select Files. And I'm going to navigate to the file on my computer. Here's my IRS W-9. I'm going to hit Open, and then it is going to upload, and it will let me know when it is done. So because it's done uploading, I can now hit Save. And you're going to notice down here is my documentation, and my requirement for my IRS W-9 form at the top now says yes. So I'm going to do the same thing for my professional license and my proof of professional liability insurance. I'm going to simply hit Create New again. I'm going to select electronic only. This time I'm going to choose my professional license, do it using a predictive search. I'm going to navigate to the file that is on my computer, select my professional license. I'm going to wait for it to be done uploading and hit Save. And then lastly, I'm going to do that for my proof of professional liability. And this is why it's good to note in the beginning of the application on that welcome page where it tells you the information you might need in order to complete your application. You can see how fast this goes because I have all of the information ready to go. If you don't have it ready to go, you can definitely stop the application and resume it when you do. But if you have all the information ahead of time that you're going to need ready to go, it makes the process that much easier. So go ahead and hit Save on my last one. And now you can see that the requirements have been met for all 3 required attachments. I'm ready to hit save and continue. I do just want to make sure to note that if you choose to send us your documents by mail, email, or fax, it's still going to say yes up top. The requirement met for saying yes doesn't mean that it's uploaded down at the bottom. It just means that you have actioned it and told us how you're going to send us the information. So if you choose mail, email, or fax, you're going to be able to continue on. You just want to make sure that you send us that documentation as soon as possible, and I will show you the cover sheet at the end in order to do so. So when you're ready and they all say yes, you can hit save to continue. The last page of our application is the agreement and submit page. This is where you're going to agree to the terms of Vermont Medicaid's enrollment, as well as submit your application. So the first thing you're going to want to do is just make sure that you read over the information at the top of this page very carefully. You are going to notice under the terms of agreement that your information has been brought over from the previous pages of the application. If anything in here looks incorrect, now is the time you're going to want to go back and correct that information. So if something's wrong with your tax ID, your social security number, your NPI, make sure that you go back and review that and make corrections before you submit the application. In some cases, there are special provisions for different provider types. And what this is saying right here is that you're going to want to go to this URL in order to determine if there are any special provisions for your specific provider type. Because if you are agreeing to the terms with it for Vermont Medicaid, you're also agreeing to these special provisions. So you're going to want to access this, go take a look. If there aren't any special provisions, that's great. But if there are, you're going to want to make sure you review that information. Once you've reviewed the information, you can hit the proceed button on the bottom right-hand corner. And this is going to open up our general provider agreement. So you're going to want to make sure that you read over the information very carefully. If you scroll to the top here, you do have the option to save it or print it or submit it into a PDF if you so choose to keep it for your records. But once you have reviewed the general provider agreement, you're going to need to accept the terms of this agreement before you can proceed. In order to do that, you're going to check the box that says I accept in the bottom right-hand corner, and a blue box is going to pop up just confirming that you do agree to the terms of the agreement. So you're going to click yes. This is going to open up a field for portal registration details. In the event of your application being approved, we do send out an invitation code for you to register for the provider portal in order to maintain your enrollment data. So what we are asking for here is who is the person that should receive that invitation code? Who is going to be responsible to maintain your enrollment data on a regular basis? So you're going to provide the information here. And the information that is provided here is going to need to be replicated when that person registers that invitation code. So just make sure that you are entering the information accurately. Below the registration details is where you are going to sign your application. It's an electronic signature. In order to do so, you're going to first check the I accept box. Then you're going to enter in your last name and first name as your signature. If you have any comments that you want Gainwell or the state of Vermont to know based as related to this application itself, you can definitely feel free to write comments in here if you need to. And then you're going to need to enter in an email address in order to get a verification code to submit your application. So I'm going to go ahead and enter in my email address. And when I'm ready, I can hit request verification code. Now you want to make sure that you're actually ready to submit your application when you do so, because once I hit request verification code and this email is sent to me, I have 10 minutes to use that code before it expires. If you're not ready to submit your application at this time, maybe you have to have somebody else review it or you want to come back to it at a later time, you absolutely can do so. You can simply click the Finish Later button and it will save the information for you. And you can resume your application. You have 30 days to resume your application. So if you don't do anything to the application after 30 days, it is going to expire and you would have to start all over. But you do have that 30-day window to resume it and to submit your application. I'm ready to submit it today, so I'm going to go ahead and hit Request Verification Code. And it's going to tell me that the code's been sent to this email address and that it will expire after 10 minutes. I'm going to click OK, and I'm going to go and get that code. So I do have my code, and I have simply copied it from my email, and I'm going to enter it and paste it right into here. So you can copy and paste. I do want to note that you do have to enter it exactly like it is in your email. So it's capitalized in my email. I need to make sure it's capitalized here. So it's easiest just to copy and paste it over into that field. Now that I have my verification code, I'm ready to submit. All I need to do is hit the submit button in the bottom right-hand corner. It's going to come up with a confirmation to make sure, yes, I actually really do want to submit. So I'm going to select yes. And I'm going to get a confirmation that my submission was successful. So it's letting me know that my application has been submitted. My tracking number is below. It is also in that email that I got in the beginning. If you need to contact the enrollment team, you can do so below, and here is the contact information. If you did choose to send in your documentation via email, mail, or fax, you're going to want to access this cover sheet. This cover sheet is going to need to come with those documents so that we know here at Gainwell which application to attach the documents to. So if you just send the documents, it may not be clear to us which application these go to. So you want to make sure that you're sending it to us. So here's what the cover sheet looks like. It's just saying these are the required documents and to make sure to send them in. So you just want to print this out, send it in with your documents when you're submitting them. But we did it electronically today, so I don't even need to access this or do anything with it. My documents have already been submitted along with my application. So there's nothing more for me to do at this time related to this application. It is now with the Gainwell Technologies enrollment team, and we'll go through that process. But before I close out for today, I do want to just note a couple things that if you need to resume your application or check status, you can go right back to that menu button from the beginning, hover over provider enrollment, and here's where you're going to resume your enrollment application. All you're going to need is that ATN or that application tracking number and the password that you used when you registered the application itself. And that's going to be the same for enrollment status. If at any time you want to know where your application stands, you can check enrollment status by, again, using that ATN and that password, and it's going to tell you where it is in the process. Again, if you have any questions or any concerns about the process or need any help, please feel free to contact the Provider Services Help Desk at the number below, or you can email the enrollment department directly. Thank you so much for attending this training today. I hope you have a wonderful day.